Today we will be studying the visual field effects. But before that, we should know that the light travels in a straight pathway. So let's see for simplicity that the anterior view is showing us the retina. Just for simplicity we are saying it, okay? And all the area in front of your eye is the visual field. As we know, this is the medial end and this is the lateral end. So this medial end is showing the nasal half of the retina and the lateral end is showing the temporal half of the retina. This is the upper retina and this is the lower retina, right? So as the visual field, let's see how we discuss it. If the image is coming from the lower end of the visual field, the image or light will strike the upper end of the retina. So simple. Now, if we see that the image is coming from your visual field in a form of a light rays, it will hit the lower end of the retina. Now, if the visual field from your nasal side is hitting the temporal side of your retina, right? Now similarly, the visual field from the lateral side on which my hand is showing the pathway of the light rays or taking image towards the nasal half of the retina. Okay, so simple rule is that the up go down and the down go up. The lateral aspect is touching the nasal side and the medial side of the visual field is touching the temporal side of the retina. Okay, again in this lateral view, let me discuss that if the image is hitting from the lower end, it will be touching the upper end of the retina. And if the visual field from above is coming towards your eye, so as it follows the rule of the pathway of the light, it will hit the lower end of the retina. Okay. Now the second step is to learn about the visual pathway. As you can see, the both eyes, the left eye and the right eye. Here lies the retina showing the optic disc. So this is the optic nerve. Of course, bilaterally they are showing the decussation of the fibers in the optic chiasm or optic chiasma. And now you can see that there lies the two optic tracts and they are taking fibers towards the lateral geniculate bodies. This is the left and this is the right. And then they are forming the optic radiations, right, on both sides to reach the visual cortex which lies in the occipital lobe. So this is the visual pathway, and now we will study that how the image is formed and what happens in various visual defects. As you can see in the picture that this whole region is the visual field. This is the left visual field and this is the right visual field. Same, this is the left eye and this is the right eye, and this region is showing the left retina and this is the right retina. So again, the thing we have already discussed about the light traveling. So let's see what happens. For simplicity, we divide the left visual field into two. This is the temporal side and this is the nasal side. Again, on right side, this is the temporal side and this is the nasal side. Or you can simply say this is the medial and this is the lateral end of the visual field. Again, this is the lateral and this is the medial. So as we can see that the fibers of the retina present on the nasal side is receiving all the information from the lateral half of the visual field. Okay, and the temporal fibers, they are receiving all the information or image from the medial side of the visual field, right? So again, here you can learn this is the nasal half and this is the temporal half of the visual field. Again, in the retina, the lateral or temporal retina will receive the nasal visual field and the nasal retinal fibers will receive the temporal visual field. So what happened next? As you can see that the fibers from the temporal half of the retina, they will run in the optic nerve, then they will reach the optic chiasm. So ipsilaterally they are passing through the optic tract. Same is the case with the opposite side temporal fibers, but the different thing happens with the nasal fibers. Your nasal retina taking information from the lateral aspect of your visual field, of course, it will take all the information within the retina and then through the optic nerve. What happens when they reach the optic chiasma? These fibers decussate. So left-sided nasal fibers will enter into the right optic tract and see on the right side. The nasal fibers of the right retina, after passing through the optic nerve, when they reach the optic chiasm, they also decussate and reach the left optic tract. So this is very important that the nasal fibers on both sides, they are decussating and reaching the opposite side of the optic tract. Okay, again the picture is in front of you that this hole is the visual field, this is the left, this is the right, and we can see that the temporal visual field of the left side and temporal visual field of the right side, and the middle area is representing the nasal visual fields of both sides, right? And as we have learned that within the retina the fibers are reaching accordingly, let me revise, the temporal visual field will hit the nasal fibers of the retina and the nasal visual field will hit the temporal region of the retina. Same is in the other eye. Now you see that the temporal fibers are running ipsilaterally to reach the lateral geniculate body. Again you can see on the right eye as well. Now what happens with the nasal fibers? The nasal retina or nasal fibers, they are taking information and when they reach the optic chiasm, they decussate. And finally, this left nasal fibers are reaching through the right optic tract in the right geniculate body. And the left nasal fibers, after collecting information from the right or temporal visual field, they are getting information and all the fibers in the optic nerve, after entering into optic chiasm, they decussate to reach in the left geniculate body. Okay, then the optic radiations on both sides will hit the occipital this lobe in the visual cortex. Okay, now I picture just to remind you all the previous things we have discussed. As we know that light travels in a straight pathway, so if you can see a tree, the upper leafy area is hitting the lower end of the retina and the stem area or bark area of the tree is hitting the upper part of the retina. In this way we get the inverted image, right? So simple that the up goes down and the down goes up. Okay, and we should also know that the things that are coming from right side should hit the left side of the retina and the information from the left side will hit the right side of the retina. Now let's see what happens next. In continuation with the previous picture, we have to learn another important thing. As we know that the visual field from the upper region is hitting the lower retina and in green lines it has to pass through the optic nerve and then it travels finally into the geniculate body right? Now what happens to these upper fibers? They will be going towards the temporal lobe, right? And in this way, they are making a Mayer's loop because they have to travel a longer course and they become the ventral optic radiations. Okay, so if we imagine that there lies a lateral ventricle, so inferior horn is located along with this temporal, I would say, lobe. So this Meyer loop that will wind round the inferior horn of the lateral ventricle to reach the occipital lobe, and in the visual cortex it will reach in the lingual gyrus, which is below this calcarine sulcus, right? So now what you see next, the lower visual field is hitting the upper retina. These fibers, after running through visual pathway, is after crossing the lateral geniculate body, it has to run through the parietal lobe via your internal capsule as a dorsal optic radiation, and it will reach your cuneus gyrus, which is definitely above the calcarine sulcus. So the simple rule that the lower fibers will pass through the upper or parietal lobe to reach the cuneus gyrus, and the upper visual field information now hitting the lower retina becomes lower fibers, and they wind round the this inferior horn of the lateral ventricle within the temporal lobe. So they form a Mayer's loop to reach the lingual gyrus, which is of course below the calcarine sulcus. Okay. Now in this picture, now you are aware that all the information when they reach the lateral geniculate bodies, the green line is showing the Mayer's loop on both sides, and this brown or reddish dotted line is the fibers which are running through the parietal lobe, right? Okay, this is the visual cortex on both sides within the occipital lobe, right? Now for the visual field defects, concentrate that this region is telling us about the visual fields. So if this hole is the left visual field and this is the right visual field, further divide it. This visual field has got the left side and the right side, or we can say the temporal side and the nasal side. Now concentrate on the right visual field. Again, for simplicity, this is the left and this is right, or you can say this is the nasal visual field or right temporal visual field, right? Okay, we have already learned the mechanism that the left temporal is hitting the left nasal retina, right? And the left field of vision, its nasal side fibers are hitting the temporal fibers of the retina, and same we have learned in the other eye. Okay, now let's see that how we learn various type of lesions and defects. So let's see, if we cut the left optic nerve, as you can see the red line, or optic nerve is severed on the left side, so we must have got complete loss of vision in our left eye. Now here you can see that the left eye of the patient is completely blind. So we call it as left anopia, right? And the right eye is of course totally healthy. Now see, if there is a cut in the middle of the optic chiasm in the longitudinal way, now what we have cut here, let's see, we have cut the left temporal field image which has to pass through the nasal fibers of the retina. They are crossing towards the right side. And what else is being severed here? You can see that the right temporal fibers or visual field is hitting the nasal side of the right retina, and as the fibers run, they also decussate and reaches toward the geniculate body. So now as we see the cut lies here, so it will impair the bitemporal hemianopia. It will create what happens that both this left side of the left eye and right side of the right eye. So how it happens? Both are the bitemporal. Let me show you again what happens when the cut is here. What happens that the nasal fibers are receiving left temporal field, and here you see that the right nasal fibers, they are receiving the right temporal field. Okay, so both these temporal field of vision or bitemporal loss of vision is there, but the vision loss is half hemi, so we label it as bitemporal hemianopia. And do remember, the name of the lesion is given according to the loss in the field of vision, right? Okay, now let's see if the right optic tract is being severed or cut. As you can see, this red line being marked by the C, so we must be having the left homonymous hemianopia. Anopia means blindness, hemi means half, so half blindness in both eyes. But on the left side, what do you see? As you have seen this cut, what it is receiving, if you trace it back, you can see that left temporal field is giving information to the nasal half of the left retina, and these fibers are decussating, right? They are impaired. And on the right eye, what is happening, that ipsilateral side which is running through the optic chiasm, what they are carrying? They are carrying the nasal visual field information which is hitting the temporal side of the retina, and they are again running in the optic tract. As the right optic tract is severed or cut, so we are losing the vision which is half, so label it as hemianopia. But of course on the left side of each visual field, so we label it as left. So similar sides are affected, so we call it as homonymous. So label left homonymous hemianopia in case of the lesion of the right-sided optic tract. Okay. Now if you can see that there lies the lesion in one area, which was the Mayer's loop. So Mayer's loop was within the temporal lobe, and it was receiving information from the upper side of the visual field. Okay, so what happens? So here when it is being severed or cut, what we get? We get left homonymous superior quadrant anopia. Anopia means blindness, right? So you can see that the 1/4 part of each eye has lost its vision, which is on the same sides of both eyes, so we call it as homonymous. And the left sides of both eyes are involved, we call this as left homonymous, as superior quadrant of both eyes are involved or defect lies here, so we label or add word superior. And as we know that 1/4 area of the visual field is lost, so we label it as quadrantopia. So now read it as left homonymous superior quadrantopia. As you can see in the picture, by dividing them into 4 equal parts, only the quadrant of both similar sides are lost, so we label it as left homonymous superior quadrantopia. Now with the help of various images, we must be clear what happens. This is your visual field of both sides, the left one and the right one. So you cannot see the structures on the right side. It means right-sided optic nerve must be cut. So just you are getting the left image. So we label it as right monocular blindness or anopia. Now see the next image. Here what do you see? You can see a tunnel vision. Means you are observing in your visual field the nasal sides which are intact, but there is nothing on the temporal side bilaterally. So you label it as bitemporal hemianopia. Now see the next picture. Again, what do we see? We cannot see anything in the center or in the nasal sides. But yes, of course, we can see the structures on both temporal side. So it means there is a defect on the nasal visual fields of both eyes. So we label it as binasal hemianopia. Okay, let's see another picture. Here what you get, you see that this is the left visual field and this is the right visual field. But what happens that on the left visual field, only the left half is impaired. And see on the right visual field, again, the left visual field or visual half is impaired. So homonymously, both left-sided visual field defect is there. So we label it as left homonymous hemianopia. Now see the next picture. What happens that we can see 3/4 on both sides, but what happens that the inferior quadrant we cannot see, there lies a defect. So we label it as left inferior quadrant anopia. Okay. Again in this picture we can see the 3/4 within the visual field, but we cannot see the right side of both visual fields in its superior aspect. So we label this type of defect as right superior quadrant anopia. Okay. Now again, this picture is showing the left homonymous hemianopia, means if this is the whole left visual field and this is the right visual field, and we are again sectioning it into two. This is the left side, this is the right side, this is the left and this is the right. So the both left sides of our visual fields are impaired. So they are labeled as left homonymous hemianopia. Okay, there is another important aspect. You can see that there is the loss of half side of your visual field on both eyes, but there is the central view which is also spared on both eyes, which is called as macula region or macular sparing. Why this happens? Why your macular area is spared? Because there is a thing that we should know, that the posterior cerebral artery and the middle cerebral artery, or we can say the dual blood supply to your macular region, which is being represented in your visual cortex, is there. So if there is a blockage in one type of artery, the other artery is intact, so that causes the macular sparing. So we can label this type of picture or this type of presentation in a patient with the left homonymous hemianopia with macular sparing. Okay, this simple picture will help you to learn that if one eye is blind, right? So this blackish brownish complete loss of vision is labeled as anopia. Okay, if this is one eye and you get half loss of your vision or half visual field defect, you called it as hemianopia. Now see that the both visual fields, the right side of both visual fields is defected. We label it as right homonymous hemianopia. Why homonymous? Because both right sides are involved. Now see in this picture we have got bitemporal heteronymous hemianopia. Now the new word is there, the heteronymous. Why heteronymous? Because now here you can see that this is the left side of the visual field which is defected and this is the right side of the visual field which is defected. So now there is no homonymous, rather heteronymous. So we labeled it as bitemporal loss of half vision or bitemporal heteronymous hemianopia. Okay, Now see here what happens. We have got binasal loss of half vision. So again, this is the right side of your left visual field and this is the left side. Again, there is something which is not homonymous. So we call it as binasal heteronymous hemianopia, right? Okay, this picture also shows you something, that if the lesion is at the left optic nerve, you get complete anopia in the left eye, right? If there is a lesion at the level of optic chiasma, right? And what do you get? You get the bitemporal heteronymous hemianopia. It was the level where the nasal fibers were decussating, right? That is why we get the bitemporal heteronymous hemianopia. Now, there is another important thing, that if there is a lesion at optic tract or at lateral geniculate body or at optic radiations, we get the similar type of visual field defect, that is the homonymous hemianopia. It depends whether the right side is involved or the left side is involved. Now, see that if there is a lesion at the visual cortex, see what happens if the lesion is just at the tip of the cortex. So, we label it as right-sided homonymous macular defects. Means the macular area is defected and the patient is able to see at the periphery, okay? But there is a defect in the center due to the lesion at the tip of the cortex. So what happens in this picture? Here the lesion of the visual cortex is all around but not at the tip. So what we get? We can have right-sided homonymous hemianopia, which is sparing your macular region, or we label it as with macular sparing. Now, in this picture, we will just revise all the visual field defects. You can see this is our field of vision. This is our left eye, this is the right eye, and we have learned how the fibers have crossed. Okay, if there is a lesion on the right edge of the optic nerve, it will impair the periphery of your vision. So we label it as right visual field, which is sparing the central region. Okay, if there is the cut of right-sided optic nerve, you get complete anopia, complete blindness of the right eye. If there is a section or cut at the lateral aspect of one side of the optic chiasma, you see half or hemianopia. Okay, means half vision is lost. If there is the cut in the middle of this decussating fiber region, what we get? We get the bitemporal hemianopia. Okay. Now, if there is the section in this 5 number region or in the region of the right-sided optic tract, what we get? We get this left-sided homonymous hemianopia. Again, if there is a cut on the optic radiation, similar field of vision will be lost. And if we have got again at the right optic this destination or visual cortex which is completely transected, again we get the homonymous hemianopia. Thank you.